Welcome to today's video lecture. Today, we're going to delve into a fascinating topic, mesothelioma. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will delve into the intricacies of mesothelioma, including its definition, etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of mesothelioma and its impact on patient care. So, let's begin. Let's start with what is mesothelioma. Mesothelioma is a malignant tumor that originates in the mesothelial cells, which form a protective lining around various organs in the body. The main purpose of these cells is to produce a lubricating fluid that is released between layers, providing a slippery, non-adhesive, and protective surface to facilitate intracelular movement. The primary cause of mesothelioma is exposure to asbestos, a naturally occurring mineral once widely used in construction materials and industrial products. The primary etiology of mesothelioma is exposure to asbestos fibers. When asbestos is disturbed, microscopic fibers can be released into the air and inhaled or ingested. Over time, these fibers can accumulate in the mesothelial tissues, leading to cellular damage, inflammation, and the development of mesothelioma. There are several types of mesothelioma based on the affected site within the body. Pleural mesothelioma. This is the most common type and affects the lining of the lungs, pleura. It accounts for approximately 7 to 5% of all mesothelioma cases. Peritoneal mesothelioma. This type affects the lining of the abdomen, peritoneum, and represents about 20% of mesothelioma cases. Pericardial mesothelioma. This rare type affects the lining of the heart, pericardium, and constitutes a small percentage of mesothelioma cases. Testicular mesothelioma. This extremely rare type affects the lining of the testes and accounts for less than 1% of mesothelioma cases. The signs and symptoms of mesothelioma can vary depending on the type and stage of the cancer. Common signs and symptoms include chest or abdominal pain, shortness of breath, persistent cough, fatigue or weakness, unexplained weight loss. The pathophysiology of mesothelioma is complex and involves the interaction of various cellular and molecular processes that lead to the development and progression of the disease. Here's a detailed explanation of the pathophysiology. The main etiological factor in mesothelioma is exposure to asbestos. Asbestos is a group of naturally occurring minerals composed of long, thin fibers. It was widely used in industries such as construction, shipbuilding, and manufacturing due to its fire-resistant and insulating properties. Asbestos fibers can become airborne when disturbed, such as during mining, processing, or handling asbestos-containing materials. People working in these industries or living in close proximity to asbestos-related activities are at a higher risk of inhaling or ingesting these microscopic fibers. Once inhaled or ingested, asbestos fibers can become lodged in the mesothelial tissues, especially the pleura, which is the lining of the lungs, or peritoneum, which is the lining of the abdomen. The fibers are not easily expelled from the body and may remain trapped in the tissues for years or even decades. The presence of asbestos fibers in the mesothelial tissues triggers an inflammatory response by the immune system. Inflammatory cells, such as macrophages, attempt to engulf and remove the fibers, but they are not entirely successful, leading to chronic inflammation. Prolonged exposure to asbestos and chronic inflammation can result in DNA damage and genetic mutations in the mesothelial cells. These mutations can disrupt normal cellular processes, promoting uncontrolled cell growth and proliferation. Over time, the damaged mesothelial cells can develop into tumor masses. Mesothelioma tumors can be localized, benign, or malignant, with the malignant form being the most aggressive and cancerous. Diagnosing mesothelioma involves a comprehensive evaluation, including medical history and physical examination. A healthcare provider will review the patient's medical history, assess symptoms, and conduct a physical examination. Imaging tests, X-rays, CT scans, and MRI scans can help visualize abnormalities in the affected area and identify the presence of tumors or fluid accumulation. A tissue sample is obtained from the affected area through a biopsy procedure. The sample is then analyzed by a pathologist to confirm the presence of mesothelioma cells. Treatment options for mesothelioma depend on several factors, including the stage of the cancer, the location of the tumor, and the overall health of the patient. Common treatment modalities include: surgical options may include removal of the tumor, affected tissues, or organs, depending on the extent of the cancer. Radiation therapy. High-energy radiation is used to target and destroy cancer cells, either before or after surgery, or as a palliative treatment to alleviate symptoms. Chemotherapy. Anti-cancer drugs are administered to kill or slow down the growth of cancer cells. Chemotherapy can be used alone or in combination with surgery or radiation therapy. Targeted therapy. Targeted drugs are designed to specifically target cancer cells while minimizing damage to healthy cells. These therapies may be used in certain cases of mesothelioma. Immunotherapy. This approach uses the body's immune system to recognize and attack cancer cells. Immunotherapy can be used as a standalone treatment or in combination with other modalities. In conclusion, mesothelioma is a rare and aggressive form of cancer primarily caused by exposure to asbestos fibers. Early diagnosis, multidisciplinary treatment approaches, and ongoing research advancements are crucial in improving outcomes for mesothelioma patients. For more videos like this, please subscribe to our YouTube channel and visit our website madeformedical.com. Link is in the description. Thank you.